For every patient who discovered that superior healthcare means more than fancy technology and proficient medical experts. For every landmark research project that changed medicine to improve lives. You were there. For every hour you give back. For every dollar you share. For every life you touch. You are here. The impact is unquestionable. That's why it's simply not enough to provide superior health care. Making a difference is what matters.
These two hospitals and the Research Institute would not be here if it were not for the community and their generous support, giving of their time, giving of their talent, giving of their treasure has made it possible to offer world-class health care in the West Valley.
I don't think we would have gone this far without their help, because technology is changing. It's just like almost every day. You expect that, and that improves the quality of life for the patient. What happened is it improves the accuracy. It decreases the risk for the patient from the procedure. And all this high tech, it just very expensive. And of course, we need help.
The quality of life they've given back to patients with Parkinson's, I can tell you firsthand my experience that it gives you your life back to you, your ability to function. You can go to work or again and play your sports, and it's so meaningful that to have that given back.
That exceptional patient care experience is possible thanks to generous donations from Sun Health community partners and donors.
We've been able to do a number of things with philanthropic support, and the biggest and most obvious is our D Tower, our brand new tower that opened in February of 2009. That was made possible by a $20 million grant from the Sun Health Foundation, and without that money it wouldn't be the level or as nice as it is today.
Most recently, we were able to upgrade our digital mammography over at the Lakes Imaging Center. We were able to purchase a neuromicroscope to do advanced neurosurgery for our community. Those things would not be possible without the support of this community.
It's obvious when you go out to our facilities and see what we have, the technology, the people that are there, and going back and looking at that and knowing that these facilities are there for my customers, my family, me. It's amazing when you stop and think about what those people thought about 45 years ago, looking ahead and saying we need these facilities for the people that are going to live out here so that they don't have to drive 20 miles to the nearest hospital.
The fact that the hospitals here and Sun Health has allowed it to grow and to become into a major medical center that it is today, I think that's a significant impact that it has on patients' lives on a day-to-day basis.
Banner Health, the Sun Health team, and a community that cares work together. The result is nationally recognized healthcare, dedicated philanthropy, and a mission that transcends generations.
I can't really think of a higher calling than something like this. I know that a lot of people want to leave major money to family and to churches, but the hospital should be right up there too, because it's saving lives, it's enriching lives.
Prior to 40 years ago, we didn't even have treatments for Parkinson's disease, so most patients ended up in nursing homes being really full care. But even in the last 10 to 20 years, we've really seen advances in treatment, largely because of patients participating in clinical trials and helping us to develop new drugs to treat Parkinson's disease.
I felt with the announcement, when it was said out loud, that I had Parkinson's disease, that was the crisis that was going to change the rest of my life.
I called Joyce my biggest fan, or a groupie, if you will. She comes to all of my community lectures, and she's always sitting there in the front row, busily taking notes. She makes me feel like a rock star. She has participated in 3 clinical trials in the last 4 years. So, I mean, she herself has largely contributed to some of our advancements in Parkinson's disease research.
The money that comes in from the donations are such a vital part in Parkinson's disease because there is no cure. And if we don't actively search for it and have the funds to allow this search to come, it would make the lives of many, many millions of people less.
In addition to local programs and services, your commitment to superior healthcare reaches far beyond local boundaries. This includes internationally recognized research, such as a landmark cardiac study, funded through a $2 million grant from the Sun Health Foundation.
For the last 20 years or so, I've been focused on finding a treatment for a disease that typically hit older population, like our population here in Sun City, and that is congestive heart failure. And unfortunately, there is no treatment available for that disease. Therefore, I devoted my life and my lab to come up with a treatment for that. So what the foundation and the community of Sun City provide us with the fund to try to translate that research from the basic science, from the bench, to hopefully to a patient care.
If you really want to see where your money goes, your return on your investment, and you're saying, I support science, I support this institution, I support the research that the SHRI is doing, I want to see discoveries in Parkinson's and in Alzheimer's and in other areas, cancer, stem cells, cardiovascular disease. You want to see that, come here, look where the money's going, see what's being done. We are unique in that organization. That's the best part about it. That's the most exciting thing, is that you can see return on investment right in front of you.
Your faithful giving has raised more than $300 million for multi-hospital expansions, internationally recognized research, and the area's best healthcare, period. Because of you, Sun Health is stronger than ever.
So the physicians here are really fortunate to have a strong philanthropic community that donates the time and money so that we are able to provide state-of-the-art cardiovascular as well as orthopedic, surgical, medical, cancer care for all of our patients. And I think that the community reaps what they sow, if you will, because they are getting back in terms of a state-of-the-art facility, and I think they realize that. But they do such a terrific job. They donate more money in this community than the rest of the 22 hospitals in the Banner system put together. So we are really fortunate to have that, and I want to thank Sun Health Foundation and the community members. The generous philanthropy has allowed us to do what we do best, and it's thanks to their generous support.
I like the idea of keeping the money in the community. Then you directly benefit from it. And then should you ever need those resources, then they're there for you, right down the road where you need them.
When Sun Health Foundation came around, this was primarily an elderly community. However, over the years, the population mix has varied. We now have a lot of younger patients here. And this is evidenced by the fact that we do a lot of labor and deliveries over at Del Webb Hospital every month. So I think that the hospital has really evolved and the community has evolved from being an older generation to as well as having a significant large portion of younger patients. So by contributing to the Sun Health Foundation, by contributing to our hospital, I think we are allowing us to take care of the older generation as well as the younger generation, with the cliche being the children are our future.
The one word that I would use to describe the flow of money and donations into this cause, that word to me is hope. Hope for the future, not only mine, my children and their children's children. This process of donation is necessary for all the dreams to come true.
For today, for tomorrow, for more than 40 years, you've kept your promise. We'll keep ours.